Breton-Richmond.
Mr. Speaker, in the last sitting, the stories of Danny Latimer and Liz Cole made their individual journeys to access palliative care in Cape Breton-Richmond real. The Latimers and Coles heard the Premier loudly and clearly when he said that what happened to them was completely unacceptable. The Premier committed to ensuring that the appropriate meetings would happen with Straight Richmond Palliative Care, and he personally accepted the plan needed to meet the needs of the palliative care patients in the constituency. Rather than meeting with the Straight Richmond Palliative Care Society, the Minister, on the eve of this House sitting, instead sent them a letter directing them to contact the staff at the NSHA. Would the Minister please explain, after 5 months, why the best he could do for the Straight Richmond Palliative Care Society was to advise them to call the Health Authority?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member would know, the Nova Scotia Health Authority is responsible for the implementation of Thank you, Mr. Speaker. The Nova Scotia Health Authority is responsible for frontline operations and delivery of health care services throughout the province. Mr. Speaker, the most efficient and appropriate course of action for the individual group to discuss both the current level of service and opportunities for changes or desired changes, Mr. Speaker, would be directly to the Nova Scotia Health Authority, because that would be step one, Mr. Speaker. The Health Authority would assess that in the context of their overall review of palliative services. Thank you.
The Honourable Member for Cape Breton-Richmond.
Mr. Speaker, perhaps the Minister needs to be reminded that actually he is responsible ultimately for the Nova Scotia Health Authority. In their meeting with me, the Cole family specifically spoke of the stark differences in palliative care services in the 10-year span between the death of their father and then their mother earlier this year. They previously did not have to fight for a bed to care for their dying father as they did their mother, and they did not have to endure the pain of seeing their father not have the same access to services as their mother. The Integrated Palliative Care Strategy Planning for Action in Nova Scotia was released in May of 2014, and it included 37 recommendations to improve and enhance access to palliative care services in Nova Scotia. Please, Mr. Speaker, it's 2018. Would the Minister please detail how many of those 37 recommendations have been accepted and implemented?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member would know, the Health Authority has been working to improve the palliative services throughout the province. We have a number of initiatives within this province, which includes a combination of services within hospitals, Mr. Speaker. There's a hospice framework that's been developed, Mr. Speaker. We have communities pursuing those options in their community. There are at-home palliative options as well, Mr. Speaker, which are supported community-based, and in addition, feature, Mr. Speaker, services being provided in partnership with EHS to provide paramedic supports in communities across the province as well. So, Mr. Speaker, we're working with frontline healthcare providers, working within their scopes of practice to provide the supports that families need in providing end-of-life care. Thank you.